Good Thursday afternoon. I'm Charity Menefee, the Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to the individuals and organizations who have stepped up to be a part of our multi-agency team, answering questions about the reopening for specific sectors of our business community, such as retail, gyms, entertainment venues, and many others. As we've mentioned before, it's not possible for our reopening plan to contain an exhaustive list of all the employers and organizations types in our community and have guidance for every one of those types of organizations. Additionally, the health department cannot possibly sign off on every organization or provide individual feedback. This is why we are so thankful for this team, who will be a point of contact for different sectors of business during the reopening process. We encourage everybody to read the plan in its entirety, which is on our website. If you have additional questions after you've read the plan, you may call 311 for further assistance, and that's who will help get you to that team if needed. Additionally, a listserv is now available on our website, where employers can sign up to receive emails that contain practical strategies that employers can implement to help protect their employees and customers. Industry-specific guidance will be coming to the COVID coordinators that sign up on the listserv in the coming days. We are continuously working to expand the resources on our website and will provide more updates tomorrow during our media briefing as it relates to benchmarks and metrics that we use to determine benchmark attainment. Moving into our local situation, we have 232 confirmed cases of COVID-19 in Knox County. 199 of those have recovered. 34 individuals have been hospitalized at some point in their illness, with 3 being currently hospitalized. We are thankful to report that we have no additional deaths due to COVID complications at this time. And now we'll open it up for questions.
All right, the first question we have is from WVLT. Any idea when buffets and other similar restaurants will be allowed to reopen?
Yeah, that's buffets. Really, there's a lot of social interaction. There's a lot of ability for droplets to spread and get on food. And there's a lot of touch surfaces that multiple people have to handle. So that one's going to probably be down the road. I don't have the exact timing on that, but we'll look at the data on that and make a recommendation sometime in the future.
From WBIR, the city just announced festival on the 4th has been canceled. Can you speak to why events like this are being canceled months down the line?
I think that's a great question for the city and other event planners moving forward. We just will talk about what's in our plan right now.
Follow-up to that question is, are you looking at any other particular events that may be potential problems this summer?
We're not looking at events over the summer. We're really focused on what we're doing now and looking at the data that comes as we slowly reopen. We talk about it's dipping a toe in the water and seeing what happens as each phase progresses. So a few months down the road, we're waiting on the data for the immediate future as we make more determinations moving forward.
From WVLT, are funeral homes still limited to 10 people?
So I really think that we need to focus on the guidance from the governor's office on that. And then and they've been doing a fabulous job. Our plan does require groups, the social interactions in those groups to stay smaller, lower than 10 people. And this is really getting to trying to protect the spread of the virus or prevent the spread of the virus in this community. And so that is still in our plan right now.
From the Sentinel, you said yesterday that we should follow local rules for reopening unless the state has specific guidelines that say otherwise. The governor's office has not released detailed rules regarding worship services, saying in order number 30 that nothing mandates closure of those services. To that end, can churches in Knox County hold services this week? And does that impact outdoor/drive-in services?
That's a great question for the state. We encourage everybody who's looking at this and waiting on answers to keep an eye out on the state's website and the information coming from the governor on what those details mean, because he was very clear that that guidance comes from the state and we need to follow what he says on that.
From the Sentinel, yesterday you said that you had just gotten a Tennessee Health Alert update regarding antibody testing.
Yep.
Do you now know when antibody testing will be available in Knox County?
I don't have an exact time frame. This was actually the THON, the Tennessee Health Alert Network message that came in yesterday was to help provide guidance on when antibody testing should be used and how it should be used. And it was very broad, but the general guidance right now is antibodies testing should not be the primary mode of testing, diagnostic, treatment, anything along those lines for individuals with that you're concerned about with COVID-19. Antibody testing is a good way to get a gauge of the burden of disease in the community. So it's probably more considered research-based at this time than using for individual diagnostics was the summary of what that email was.
The follow-up question there was, if you are in the process of planning that out, when can we expect the antibody testing plans to be made public?
I don't have an exact timeline on that. We're having lots of discussions on how we'll move forward. And as soon as we have the details available, we'll give them to you.
From WATE, many are asking when to wear a mask, whether to maintain 6 feet of distance in small groups, etc. Could you revisit guidance for the public?
You know, that's a really good one that we do need to talk about and make sure that people really understand. So the 6 feet distance is something that we want to encourage people to continue to maintain. That is really important because of the way this virus is transmitted and spread from one person to the next. We masks are recommended when you can't maintain that. And in some areas, because you cannot maintain it, it's required in our plan. So again, we suggest you read the plan very carefully. And if you have questions, you can call 311. But both are very important aspects of preventing the spread of this disease. And we encourage both. They're not mutually exclusive of each other. We want you to be doing both things as much as you can.
From the Sentinel, you have said that you rely on multiple models when making decisions about Knox County, but you have not specified which models you are using. Please list the models you are using when making decisions about Knox County.
I don't want to name them off the top of my head completely, but there's IHME model, there's the Vanderbilt model, there's the Colorado model. I know there's a few more that I'm not remembering the exact names of, but we can provide those to you moving forward if you want.
And the follow-up question to that one was, do these models calculate our effective transmission number? If so, please tell us what the effective transmission is.
You know, we'll provide more information on that. I think that we're looking at, there's several models out there that have a lot of different information. So the Vanderbilt one does talk about transmission, and there's others that are out there. What we're really looking at is our local data and picture. So models are great and they do help inform decision making, but more than anything, we also want to look at what's really happening in our community on the ground. So what's our growth rate looking like? How quickly are we getting test results back? How many people are we getting into quarantine and isolation? And all of those things will help also inform our decisions. So I really, getting in the weeds on models, that's not the bulk of what we're planning with. It's really looking at our local picture.
From WATN in Memphis, switching direction a bit, I see Knox County releases COVID case numbers by zip code. Why? Do you feel there is a benefit to the public to release numbers by zip?
You know, we were getting a lot of questions about what the burden of disease was looking like in the community. And we decided to do the heat map based on case counts by zip code to help provide just a picture of how many cases we have. But we've been very careful to also explain that that zip code does not equal risk of transmission any more than anywhere else in our community. It's really just to give an idea of burden of disease in the community.
Follow-up question for that one was, is zip code reporting part of required reportable information to NEDS or similar database?
Yes, so for positive cases, but not for negative counts. And so demographic information is part of the reporting requirements.
From WBIR, Governor Lee said yesterday he wants 100% testing in all nursing homes across the state. Is the health department leading that testing in Knox County? And does it have enough tests or supplies?
So the governor's office and the state are willing to help support that and provide the needed resources to help get testing in our long-term care facilities in the community. I also think there was other discussion based on having positive cases in facilities. And so that's our focus right now, is if we have a case in a facility, to be sure to test everybody that's been in that facility. And as we get more guidance from the governor's office on the bigger scale testing, we will move forward as directed.
Also from WBIR, say sorry not to belabor the point, but under the current guidance, can churches in Knox County hold services this weekend or not? Who makes that decision, KCHD or the state?
The state. That was very clear in the governor's order 30 that the local jurisdictions cannot put requirements on faith-based community practices in any way, shape, or form. So I cannot answer that question. We're going to have to wait and see what the governor's guidance says as he releases it.
From WBLT, will students at schools have to wear masks in the fall?
We really haven't gotten that far. I think we have to see where we are. And I think that will go back to the message that we've been saying. If we do this slowly and we do this deliberately and everybody participates and does all of the things that we've been asking them to do to help slow the spread of disease, as we slowly reopen and continue to do that, we'll have a better idea. But that's what we need people to do so we can get to the point where we get out of this and we're not having to wear masks everywhere and all of those things. But we need everybody to participate now and follow all the guidance that we have now to help us get to that end goal. But I don't know when that will be. Wish I had a magic ball to be able to answer that question, but we don't have that right now.
Another question from WBLT, which I believe Charity just addressed in her answer to WBIR a second ago, but will the guidance change for places of worship since the Knox County plan is less stringent than the governor's office? I believe you just answered that question.
Yeah, we're gonna, for the places of worship, we'll follow the governor's guidance and we're just waiting on that as you are.
So from WBLT, do we know if you get COVID once you can get it again?
That's being looked at very closely right now, and we don't have a good answer for that. And we're eager to get the body of evidence to support that one way or the other so we can make good recommendations moving forward. But it's really not, we don't have a good answer at this time for that.
One more from WBLT. Are preschool classes also limited to 10 or less children in each class?
We just need to follow the guidance that's in the plan. And so there's a difference between, the 10 guidance really sits at that social interaction piece, which I know can happen in preschools and that kind of thing. But follow the guidance in the plan for your specific type of organization. And again, if you have questions or concerns, send those to 311 and we'll try to get those specifically answered for you.
From WBIR, the past few weekends, we've seen testing events over the weekend in Knox County. Mm-hmm. Will there be any such events this weekend? Why or why not?
So a couple of things. Our staff's been working 7 days a week for a long time. And so we're not doing any testing events. We'll still be doing contact tracing and investigations, but we're also not seeing a huge amount of positive cases coming out of those large testing events, very small rates. And so we're just assessing how we're going to do those moving forward, and we'll have more information soon on that. We're continuing to test here at the health department. You can call 215-5555 if you want to get tested and have questions about that. But more information will come on how we'll be doing our community testing. Not to say we won't do the large events anymore, but we're really wanting to, again, look at the data, look at the information, and do the best that we have with the resources that we have to get the people that need the testing.
From the Sentinel, you have said you're tracking COVID-like illness and clinical presentation of COVID. When are you going to make that information public?
So there'll be some information on our website, as we said in the opening statement, about our benchmarks and different data points that we're looking at, I can't even talk anymore, I'm sorry, that we're looking at. And I think that question will be addressed for you tomorrow.
Other question from the Sentinel is, what are the raw case numbers, the incidence and prevalence of COVID-like illness in the county?
I could ask one of my epidemiologists that, and they could probably get it, but I don't have it off the top of my head at this point.
Another question from the Sentinel. Can you give a quick update on the level of tests available in Knox County? Are testing supplies still hard to come by?
That's actually getting better. Testing supplies are getting better. I don't have, and we've talked about this a lot. So gathering the number of tests that are outside of our doors is a really hard number to gauge because people are getting them from private providers and other sources. But I can tell you our personal experiences is we are getting more and more tests so that we can continue to expand our testing. And we have not seen any issues in the past couple of weeks on getting those supplies. And we hope that continues.
From WATE, many in the public are not wearing masks when shopping at grocery stores and other essential box stores. With retail places opening, would you revisit the importance of wearing a mask even if you're not experiencing symptoms? We absolutely recommend that people that are going out in public wear a mask, and that's to protect both
my mask protects you and your mask protects me. Or did I say that backwards? I said it right. Okay, sorry. But we want people to wear masks. It's in every bit of our plan. It's in the general guidance that we have. We absolutely encourage people to be wearing masks. It's very important to do so.
From WATE, how often do you see a case of COVID-19 transmitted from an asymptomatic person?
So I'm trying to think of what I was been looking at recently. We have seen that. I don't have the exact number of cases, but it's been small. But we have seen some asymptomatic folks at this in our caseload.
From WATN, they say, sorry to go back to the zips, but can you explain how the heat map works in connection to the zip codes? Also, is there any scenario that you can see where zip code information would not be releasable to the public?
So we have ranges on our website for a very good reason. So when there's smaller numbers, then we make sure that's why we have ranges, and we don't say a single coast and a zip code or anything like that to help protect privacy. I can say where that comes from. So again, reportable disease, the county of jurisdiction is based on, or the classification of jurisdictions based on the county, and with that comes zip codes. We have gone by case counts in each zip code on our website at this time, because of our low number of cases, and providing rates isn't the most easily understood method when you have low case numbers. Things can look really inflated if you're doing a rate per 100,000 when you have less population in certain zip codes. So we're choosing right now to do case counts, so positive cases in those zip codes. As our case count grows and when it can be more clearly understood as a rate, we may switch to a rate, but right now that's what we're using.
From WBIR, did KCHD work with UT on its reopening plan? Is there a KCHD person on the UT's Reimagining Fall Task Force?
UT speaks to us all the time. We talk to a lot of partners and they're working on their plan, but I can't speak about their plan. We're not on their task force, but if they have questions about parts of their plan, they do contact us and we answer those to the best of our ability.
From WBLT, when will long-term care facilities start to be tested?
So as I said earlier, right now, our process is if we have a case in a long-term care facility from a staff member or a resident, then we'll test everybody in that facility. And as far as the just blanket testing, we're looking into that process and waiting on a little bit more guidance moving forward. I want to go back and also say a negative test, and we keep saying this a lot, but I just want to make sure people know a negative test means that you're negative right now at that moment. It doesn't mean that you're not potentially incubating the disease and you won't be positive later, or that you can't get the virus later. And so just want to be cautious with people when they're talking about testing and broad testing like that, that's a snapshot. And we need to continue to be vigilant in infection control practices to help prevent the spread of disease, regardless of what the test results say.
Also from WBLT, is COVID more deadly for pregnant women? Should you be more concerned if you're pregnant as Knox County reopens?
You know, they're not in one of the high risk groups, and I think that's a good thing. So when we say who's more at risk of complication, it's the senior population, it's people with heart disease, lung disease, diabetes. But we always do want our pregnant women to be extra cautious in general about getting infections, and we encourage them to continue to do that as they go into the world while we're opening more businesses.
From Sentinel, the state and federal government have been tracking COVID-like illness in emergency rooms since at least February using the syndromic surveillance network. That's also part of the county level pandemic plan.
Yep.
Have you been tracking COVID-like illness using this system? If not, why not?
We do. We use it all the time. So it's one of our data points that we look at. It's what we use for a lot of different things. You can also look at, gastrointestinal illness and see if we're seeing more of those. We look at flu-like illness, and this is one that we do look at regularly.
From WBLT, some residents say they don't have masks or access to get any. Does the Knox County Health Department have recommendations to people looking for face coverings?
You know, I think that's a really good project for our community that's wanting to know how they can help people. And so I think that we need to look at how our churches and other volunteer organizations can help support those people who are in need. We don't have specific plans right now, but we do encourage folks to help their neighbors and their friends and their family get those masks. And we'll report more if we know of those plans that exist.
All right, we got time for just about one more question. From WATE, if you are out shopping or going for a walk and you see large numbers of people not following guidance, what's your recommendation for a person concerned about his or her safety?
If you're out shopping and we're talking about in a facility organization, I mean, that's something that you can call and have a question about, call 311, and we'll be gathering that information and following up with complaints. And outside of that, in individual groups, personal safety is always most important. And so in the world I come from, is my safety is most important. So I would avoid those groups. And you can always let us know if you're seeing those types of issues. But first and foremost, make sure you're protecting your safety and not getting up in the middle of that you have a mask on if you are going to be around people, that you're not going out when you're sick. All that personal responsibility piece is what's most important.
All right, we had 2 questions just come in last minute, so we'll answer these 2 questions, and that's all we have time for today. From WBIR, this has been a long couple of months for many, many people in our community, but it's been especially busy for the KCHD team.
Mm-hmm.
How is the team holding up? And is there anything people in the community can do to support you?
Thank you for that question. We appreciate it. It has been a long couple of months. Thankfully, we have a great team here and a very much a family environment where we're supporting each other and helping each other. And we try to find time to laugh when we can and help each other through this time. And how you can help us, hearing encouraging things is always great. We get a lot of negative feedback, so positive feedback's wonderful if you think we are doing a good job, and then doing all the things that we're asking you to do to protect the community, that you're washing your hands, you're wearing your mask when you go out, that you're staying 6 feet away from people, following the guidance. When I go out to the grocery store and seeing people in masks and doing all the things that we ask, that is a win for me, and that makes our team feel good when we see that when we're out.
All right, and the final question we have time for today is from the Sentinel. Since you're using the syndromic surveillance system, can you please release the local data?
So a lot of that will be, let's talk about the benchmarks tomorrow, but a lot of that information will be available there as well. So I think that you'll be happy with what you're seeing as we move forward and open up more information on our website.
All right, thank you everyone. We appreciate it, and we will see you tomorrow at 12:30.